So one of the most popular procedures that we do at Farber Plastic Surgery is breast surgery. Whether it be breast augmentation or a breast lift in combination with the breast augmentation or a breast lift alone. Now, what a breast augmentation will do is it will increase the volume of the breast. This will enhance the female figure to add curves to the body, and it will also give more volume, both upper pole fullness, lateral breast fullness, to allow women to fill out their clothes better, feel more self-confident, and feel better about their overall appearance. Now, when we talk about breast augmentation, there are 4 main questions that we like to answer. One is saline versus silicone. They both give a very pretty natural result. Silicone may look and feel a little bit more natural due to the fact that it's a little more viscous of a fluid inside. It's the same silicone shell, and we do both based on what the patient's desires are, as well as anatomical considerations. The next question that we like to answer is above or below the muscle. And again, this tends to really relate to patient desires in terms of aesthetics, and also their anatomy dictates whether or not we go above or below the muscle. Another question that we like to answer is incision placement. The most common incisions are underneath the areola or underneath the breast. They both have their benefits and they both also have their drawbacks. So this is a discussion that we're going to have with the patients to really determine what incision placement is best for the patient. And lastly, size. When we determine size, we use a lot of biodimensional planning. So this takes measurements of the body, and based on those measurements, that's how we determine what implant fits the body. So it's not too wide, it's not too narrow, and then we can alter the height of the implant to really get the desired aesthetic that we want. So when we talk about breast augmentation, there's a lot of questions that we answer. Saline versus silicone, incision placement, whether it be under the areola or underneath the breast, position of the implant, above or below the muscle. One of the most important things we discuss, and what patients are oftentimes the most concerned about, is size. How do we choose the correct size implant? We use what's called biodimensional planning. So we take measurements of the body, and based on those measurements, we can tell what implant is going to fit the body. So if you see, we really want to see, number one, the base width of the chest. So the width of the chest corresponds to the width of the implant. We don't want an implant that's too wide. We don't want an implant that's too narrow. We want it to fit the body pretty and appropriately. Basically, once you find that implant, then you can change the profile or the height of the implant to get the desired size that we want. So once we have a range of implant that we are trying to put the patient in, we can then try on different sizes to give the patient an idea of the volume, how it's going to feel, how they're going to fill out clothes. And this is very important. We use what's called an implant sizing kit. So we take implant simulators and we put them in the bra, and it really can show the patient exactly how she's going to look in her implants. She can see the upper pole fullness. She can see the contour of her breasts. And if you look, when she faces the side, you can also see the contour from the chest all the way into the breast. And that's what women really want to see, is how they're going to look with the breast implants. So one of the questions that patients often ask is saline versus silicone. It looks more natural, it feels more natural, and this saline, while it gives a very good aesthetic to the breast, it really doesn't look and feel as natural. So the silicone that we use is a cohesive gel implant. It kind of looks like a gummy bear. So if you cut it in half, it actually would look like a gummy bear. So it gives that natural appearance to the breast, that natural feel to the breast, and patients are very quite happy with silicone implants.